As Dr. Meyer just kind of highlighted, a lot of our focus on rotator cuff treatment has really, and probably rightfully so, focused on the surgical techniques and approaches. And a very reasonable question, I think all of us realize, having treated patients, is does every cuff need to get fixed, and is there a role for non-operative treatment? And if so, what is that role? I don't have any disclosures. So if we think about injury and orthopedic disease in general, most of the time when we think about disease states, a patient will usually have increased symptoms with increased severity of disease. So you think about osteoarthritis, you think about instability, both glenohumeral and AC. Typically, the more severe the disease state, the more symptoms the patient will have. In the setting of rotator cuff tears, many are often asymptomatic. So one of the really important questions are, does pain really correlate with rotator cuff severity? So back in 2014, this was from the Moon Shoulder group. They looked to answer this question. Symptoms of pain do not correlate with rotator cuff tear severity. So they looked at about 400 patients. No measure of pain really correlated with any measure of rotator cuff severity. So that brings us out of our traditional thought processes when we think about disease states in this orthopedic realm. So it's very reasonable to subsequently think about, is non-operative treatment of rotator cuff tears effective? Now, one of the things I want to highlight here is we're not talking about acute tears. This is more in the chronic setting, which is the majority of oftentimes what we see in our clinic. So what was the success? So there's some seminal articles out there over the years, some older. This is a prospective cohort study with about 50 patients. Average age was about 60. Mean duration of symptoms was 2 years. So this is chronic rotator cuff syndrome. And these patients went through a home-based therapy program for 3 months. 38 of those 50, about 76%, declined surgery at 3 months because their quality of life and functional scores were adequate. And so that's interesting. So as we think about how do you treat shoulder non-operatively, how do you treat a cuff non-operatively? Obviously, physical therapy is the standard and hallmark of this. So what is the actual effectiveness of physical therapy in treating atraumatic full-thickness rotator cuff tears? So this, again, was from the Moon Shoulder group, and this won the 2011 Near Award, and this was seminal because as we looked at this, it really looked at, is non-operative treatment effective? This was a multi-center prospective cohort. 452 patients were enrolled, and the average age of the patient was 63 years. All these patients, the inclusion criteria included atraumatic full-thickness rotator cuff tears. They were treated with an evidence-based physical therapy program and followed in near term 6 and 12 weeks and longer term 1 and 2 years. So what was seen? So when one of the really key pieces in this study was the demographic and comorbidities were controlled for, and there were outcome scores that we traditionally look at for functional utility for patients. So the results, and I highlight this, if you look at 6, 12, 1 year, and 2 years, out of this patient cohort, ended up being about 20%, if you look at in total, went to surgery after a trial of PT. Most of who went to surgery, if you look back, did so within the first 6 to 12 weeks. And the results didn't seem to worsen with time. So I think that was kind of a seminal call for us to kind of consider this as this non-operative role in the treatment of chronic rotator cuff disease. So what are the patient outcome measures after non-operative treatment? If you look at what was presented in this, and you look at the functional scores, the ASES, the work, and the SANE, from baseline at 6 and 12 weeks, there was a clinically significant improvement in a lot of these scores with non-operative treatment. So the conclusions from this were that a physical therapy program is effective non-operative treatment for atraumatic rotator cuff tears. I remember listening to a talk from Jed Kuhn several years back, right around this time when this was published, and he has this mantra that I still remember to this date, that MRI is a tool of the devil in chronic rotator cuff disease. So, because what that goes back to is some of the original slides we were considering. Does what the picture looks like correlate with how the patient is doing? So, as you look at this, the outcome scores improved over 12 weeks. Less than 20% of patients failed and ended up having surgery. So the other takeaway from this was that the effectiveness of physical therapy is really revealed early. The patients who chose to have surgery typically, again, do in the first month and a half to 3 months. And after 12 weeks, the effectiveness lasts at least a couple of years as this was followed out. So more recently, there was another surgical versus non-surgical management of rotator cuff tears. And this was really a matched pair analysis. And I really enjoyed reading this last year when it came out, because this was a prospective cohort. They looked at a little over 200 patients and really matched the groups. And again, these are full thickness chronic rotator cuff tears. And they really matched the groups, and there were no significant differences in demographics or tear characteristics between the groups. Both groups reported improvement in pain and functional outcome scores. But if you really look at the subset analysis and regression analysis, the patients who were offered and who chose rotator cuff repair reported greater improvement in their outcome scores and reduced pain versus those who chose non-operative treatment. And some of the mantra that we'll see also that will be highlighted and that we know is that the better outcomes are really associated with younger age, shorter symptom duration, and rotator cuff repair. So what about some of these biologic options? I know there's going to be, there's been mention of it, and Dr. Dragoo will have a nice talk later in the morning, early afternoon about this, but really in the non-operative setting, the non-perioperative or intraoperative setting, there's insufficient evidence to routinely recommend PRP for rotator cuff tendinopathy. And if you really look at injuries, PRP may reduce pain associated with rotator cuff injuries, but when you look at this meta-analysis and review, systematic review, there's a lot of heterogeneity in baseline, short and long-term follow-up. So we really don't know what the role of some of these biologic treatments in the outpatient realm would be. So what we need to do, and like in a lot of settings, especially with our biologics, is that we need to have more double-blinded, randomized control investigations with larger sample sizes and matched pair controls, and standardize our PRP preparations, which at CU we are in the process of doing that in a standardized manner across a lot of our sites when we're looking at our biologic approaches. So with this information, how do we approach the atraumatic rotator cuff? So what do we need to consider? There are a lot of people who have asymptomatic rotator cuff tears. The results are good, even in the event if you have surgery and you have surgical failure, as Braden mentioned, oftentimes you do well. And there's no correlation between the severity of disease and pain. So we need to consider the variables, right? So, again, in a chronic setting, youth has its advantages. There's environmental factors, there's comorbidities, there's biology, right? Biology of tissue repair, and you want to think about the size of the tear as all really, really important variables to consider. So I think non-operative treatment has a role. It's definitely an option. If the patient fails this treatment, or obviously in an acute tear setting or tear in a younger patient, then surgery is obviously an option. I've got great colleagues that I refer to all the time and take great care of all our patients. So thank you.